Thank you. I'm going to give two talks today. One is on our experience with AcuPulse, which we've had for, I think, about 3 years now or so. And then we'll talk and specifically about the different modes, or I'll de-emphasize the modes so much as emphasize the indications for in our practice. And in the second talk, we'll discuss the M22 platform and our experience with the Resurfix and the Q-switch handpiece. So a lot of this is, background information. We did some original work with this device, and back probably 4 or 5 years ago, looking at the super pulse in comparison to ultra pulse, and we found a lot of similarities between the two pulse structures histologically, enough so to make me realize that there's not actually that much of a difference at the energy ranges that we use most commonly in terms of those two pulse structures. So right off the bat, you've got the ultra pulse, which we have as well. Which is at one price point, but the AcuPulse actually can function very well, as I'll show you, using the super pulse mode, even though you're not getting the same peak power, but you're still getting histologically the same response. And then I'll talk a little bit about the hand pieces and so forth and what's involved with that. And one thing I like about it the most is the interface, actually. So it gets confusing with all these hand pieces. So that's one thing I would suggest when you're starting out is get your hand pieces in order and get your staff comfortable with them, because it gets a little confusing. The AcuScan is one thing, but when you're doing the different surgical and incisional hand pieces, you want to have it all arranged properly. We don't do all of these modes that you'll see here, but we do quite a few of them. Again, I'll probably focus more on the combo mode. We have a lot of experience with that. Talk a little bit about stretch mode and a little bit about the fine touch mode with respect to the feather touch. Feather touch actually has been around for a long time in some of the other ESC Sharpwood models, and we use it a lot in a certain subset of patients. It's fully ablative CO2, so it has some of the downtime with that, but some of the results I just can't seem to get with fractionals. We use the AcuScan 20 most commonly for most of our procedures, and it's very comfortable to use. We also use the SurgiTouch, so we'll use the incisional handpiece and the F120 and 260 handpieces for the feather touch. So as far as the combo mode goes, again, this is a lot of background information that you already know. I like the fact that they can happen simultaneously, but you can also do either one individually, however you want to do it. Our indications in our office typically fine lines, wrinkles, periorbital wrinkles, perioral wrinkles, acne scarring, some photoaging, which I typically change for the M22, depending. Settings can be varied independently, so we'll use we'll set the deep settings potentially more aggressively depending on how deep the wrinkles are, and then superficial settings depending on what I see in the epidermal changes. So I think dermal and epidermal here. Again, I like the fact that they're simultaneous, and so that makes it a little bit easier for numbing purposes. And although the spot size is a little bit smaller, I find that I save about the same amount of time doing doing one pass instead of, say, two with the ultra pulse. And this is what the different densities look like. When I'm doing full face, I'll try to stay as high of a spot size as I can, and I typically vary anywhere between 10 to 20. I usually don't go to 25. It depends with the deep, and I usually stay with the square spot size. I use the linear spot size quite a bit when I'm trying to treat the deep furrows of a wrinkle, so that's very good to have that flexibility. More details on that. The downtime for this typically is a little bit longer if you're in the combo mode, because you're using the deep as well. So I typically tell patients about 5 days or so, 5-7 days, and I try to do their treatments in one sitting if I can. So if I can get a little bit more aggressive, I'll do that. But sometimes when I have them come back for a second treatment, it's not for several months, because they get benefit from the CO2 for several months after that. This is some of the histology that we did, kind of showing the deep and superficial modes, and so I explained to patients why we need to use a combination laser, because they have dermal lesions, which are wrinkles, and epidermal lesions, which is the photoaging and epidermal changes. We typically do this with smoke evacuator, and we usually use local anesthesia. It depends on what we're doing with some IM sedation. You can see the eye shields in place, so we can go all the way up to the preceptal orbicularis, and usually a full treatment can take 45 minutes to an hour, depending on the numbing and how the patients are tolerating the procedure. This is some of Dr. Clementoni's pictures, just talking about the acne. This is actually a very good result with acne scarring, and it demonstrates that depending on, you target your depth depending on what lesion you're treating. So you can see he's gone deeper in the areas of the acne scarring, a lot more superficial in areas where he didn't need to. So that's what I really like about this treatment. Here's the deep areas. And then, of course, you have to deal with the downtimes. You have to explain to patients that there's more erythema, a little bit more of a reaction in the deep areas, and they're not going to heal synchronously. So you have a little bit delayed healing in the deeper components. And this is after several months, and then after 8 months. And when I show these pictures to patients, they're very impressed. This is reproducible with acne scarring on the other side. And then after 8 months as well. So you notice the residual erythema is gone, and the acne scarring is much improved. We've done treatments, using the combination of the combo mode and the M22 mode. This was a patient that had several treatments, worked outdoors in landscaping, believe it or not, and a very attractive lady, but she just had a lot of combination damage. So you couldn't just treat this patient with IPL because you wouldn't get improvement in the wrinkles. But she drove from 3 or 4 hours away. So we actually combined the combo mode and the M22 mode in one single treatment. And I would do the M22 first and then the combo mode second. And she came back and we really didn't need to do much more. She also had acne scarring on her cheeks, so I used the same technique that you just saw, and that improved as well. So this is another patient of mine with this is just the combo mode. So you can see where we've gone deeper around the eyes, a little bit around the mouth, more superficial, in other places, but you can see a really good result here. And of course, when you get more aggressive, so when I turn up the energy on the deep, you'll see that it's more erythema, but that resolved. So what I would typically do, with the combo mode, so, you don't have to go back. You don't have to really do 2 passes anymore. So a single pass to this area, a single pass to all these areas. I would do a double pass here using the deep and then the combo mode at a lower setting, and so that's where you get the flexibility in changing your parameters. She's a little pink. This is probably about six to 8 weeks out, but you can see the improvement in the texture and the wrinkling, and she was very happy with them. And this is her from the front. Again, you can see she's still healing from double passes around the eyes and the mouth, but this was a single treatment. So. This is another patient that had we combo mode on, but we went a little deeper around the mouth. So we turned up the deep component on the combo mode around the mouth, but the rest we used combo mode at relatively non-aggressive settings. And here she is before and after, and you can see an improvement in the wrinkles. So this was, again, just with that combo mode. This is another one that we did. This is probably the worst case scenario, and this is one we've published in the white paper. But we had to go back. We used the combo mode, but we had to go back and do several passes with the deep. We had to change from the line setting to the pattern to the larger pattern, hit each furrow, do a little bit of wiping. So it's probably about 2 to 3 passes, and then you can see the improvement around the mouth. And she was very pleased with that. But again, I used the combo mode all over to blend everything in. So this is an example of a gentleman who has rhinophyma, and this was a recent patient, probably about 3 months ago. And you can see a reduction in the nose. Again, we used the combo mode to sculpt and wipe and then and contract the skin. So you see he's got a lot better contour of his nose than he had before. So you have a lot of flexibility with this mode. So we're going to switch gears to the incisional handpiece. So incisional handpiece is used for cutting, obviously. Continuous wave cutting motion, typically 5 watts, 6 watts, somewhere in that range. And you can use it to do excisions for skin cancers. I typically use it for eyelid surgery. And so a case like this, where she has upper eyelid heaviness, lower lid festooning. And so the nice thing with this laser is I can use the cutting mode to get rid of the excess skin, then put on the AcuScan handpiece combo mode and treat the rest of her face. That's exactly what we did. So you notice how the upper eyelid improved, the lower lid improved with a blepharoplasty, but then we were able to resurface the whole area with the combo mode as well, all at the same machine without changing too much, and she got a good result. Same thing here. I used the incisional mode to treat the upper lids and the lower lids, and then we went right back with the combo mode and to tighten around the lids. So all that within the same machine. Another example, this was a transcutaneous, not a transconjunctival bleph, but made the incision with the laser, took out some extra skin, and then used both the fine touch and the combo mode to resurface around her lower lids. So she got rid of serrangomas, extra skin, and then and you can see the difference here using the combo mode all over to get blending. So Stretch Touch, we have some experience with this. It uses the AcuScan handpiece again, and we're basically targeting the stretch marks only. Our goal is to try to increase dermal collagen and elastic tissue and improve the appearance of stretch marks. Why do they happen? Many different reasons. Typically, it's either large, rapid weight gain or weight loss, which you'll see during pregnancy. You can see it in bodybuilders, young adults, female and male, that just expand their body mass too high. It's a big problem, and there's really not a good solution for it right now. So I prefer to use CO2 over the non-ablative wavelengths just because of the heat that it generates. This was a study that was done out of Brazil, and I don't know if Guillermo is here at the meeting. He used ultrapulse, and we found similar results with some of the patients, but this was a very large study in treating, and we've had some good results treating stretch marks on the breast, stretch marks in the abdomen. Okay. And you can see here in his study, this is the kind of stretch marks we would target, probably starting with either the pulse dye or something to get rid of the red, and then following up with the narrow pattern and tracing out each of the stretch marks to get improvement. This was a really nice improvement. This is similar to what we've seen in some of the patients. It's another study. In terms of the settings that we use, you can see we don't use very high density with these. We use actually very low density, 5-10%, and I actually go higher on the joules now. So I'm going up to probably 15, 20 millijoules. So you're not getting a lot of contraction at the skin, but you're getting a lot of penetration into the 1.2 millimeter range, and so you're getting a nice column of heat in there. So again, it helps to have different patterns because stretch marks can be wide, they can be narrow, and so we they can be fine. So it's nice to have different patterns to choose from. And so the way we typically do it is, again, as I mentioned, high. I like to use low to medium density on the stretch mark itself, and a higher energy. And then if I'm sculpting off the stretch mark, I might change that a little bit because I want to get contraction around the edges. The number of treatments that we typically do, 3 to 5 treatments, but you can get some erythema for sure, so you have to back off on that. Remember, you're off the face typically, so erythema lasts for 4 to 6 weeks sometimes, so you don't want to overlap. You want to let that go before you treat again. So this is why we typically stretch these out for 2 to 3 months. So the fine touch, feather touch mode, I use the feather touch mode, and I'll show you the indications here. It depends on the handpiece. You can use the F125 or the larger handpiece if you're treating a spot versus a full face. Remember, this is a fully ablative procedure, so you're getting really nice contraction. The healing is a little bit more. You can do smaller spot size, or with the larger handpiece, you get a bigger pattern. Small spot sizes. So this is the type of patient you might say, well, you could treat with the fractional laser. But actually, after one feather touch treatment, you can see how much the fine lines have improved, especially around the eyes, and they've gotten more contraction. I find that I get much more contraction with the feather touch mode. So this was one patient. This was another patient of ours. You see, she still has a little bit of erythema, but a lot of nice blending. Skin texture is much improved. These are the kind of patients that I'll switch to the feather touch mode. Again, she's still got a little bit of erythema, but you can see the nice soft texture, especially around the eyes and mouth. And this is with a single treatment, single pass. Now, they do stay red for a lot longer. They'll stay red, erythematous, for probably 2 weeks as they fade along, and you have to use some topical steroids and so forth. And it's a little bit more sensitive, but that's the kind of improvement. And so I've almost switched to doing feather touch on these type of patients around the eyes before I do anything else. So.